Hey guys, my name is Masud. Welcome back to the YouTube channel. It's been quite a while since I last recorded a YouTube video, but I wanted to make a return today. And in today's video, I wanted to just open up a little bit of discussion about something that tends to happen to me during my practice all the time. And obviously, I know what my clinical mentor would tell me, but I just wanted to see if anyone would do anything different. So the topic of discussion today is, what do you actually do when your patient is not getting better as a result of your treatment? So let's just give you a scenario. Let's say our patient has been seeing us for the last, 6 to 7 sessions over a 2-month period, and you've given them an appropriate home exercise program to treat them. As well as that, they're also coming into the sessions to receive manual therapy from you, but they just don't seem to be making any improvement in the scope of their exercise program, or in terms of just generally reducing their overall pain, pain score on the visual analog scale. So they're still saying, their pain is a high number out of 10, and it's like not budging at all. So usually when it gets to this stage, usually before, I used to get really, as a student especially, I used to get confused and kind of nervous because I didn't know what the hell I should do. And I think only recently, after nearly having practiced professionally for like 2 years, I've started to understand that it's not always your fault. It's not always the patient's fault, and it is what it is sometimes. But if we were to actually, delve into that scenario a little bit, a few reasons come to my mind as to why that patient isn't getting better. Now, of course, we know that there are so many variables that could come into play here, and we can probably ask about. But for the sake of this video and just keeping it brief, we're going to say that, we're going to keep those same constructs that we've just mentioned. So the patient has been coming to you for the last 6 to 8 sessions. It's a musculoskeletal clinic, and they've had a pain in their lower back, which they can't shake off, and you've given them an exercise program to work on their glutes and their core, and you've also provided them with some manual therapy sessions whilst they were with you in the last few sessions, but they just didn't seem to be, making any improvement. So usually I've found that in this kind of scenario, it's usually because either the patient has become reliant on you providing them manual therapy to give them relief, and that allows them to cope with their pain a lot better than if they were doing anything themselves. Then this leads on to another point, which is the patient usually, sometimes, it just don't do any of their exercises or follow any of the advice that you recommended, but they say that they do, and then when you ask them, you can blatantly tell that they're not telling the truth. Usually I'd say something like, okay, can you run me through your exercises and maybe just talk me through how you're doing them? Really put them on the spot, and I think that's the best way to find out. But yeah, anyway, so it's either one of those 2 points, or they might have like a pain disorder, or like a chronic pain sort of disorder that they've been managing for a long time, and their symptoms have been masked by this disorder, so it's hard to see if what you're actually getting them to do is, having any improvement on the health or on the outcomes. So what do you actually do? To be honest, I'd probably go back and maybe speak to the patient and ask them why they feel they're not getting better, because usually after that long of having physio, you tend to see some sort of effect, no matter what the actual injury is. So yeah, trying to communicate that with your patient, asking them why they feel they're not getting better, and maybe just listening to them. And if that doesn't work, I think that I'd go back and reassess their, their movements and look at their subjective history a little bit more in detail. It may be that it was a misdiagnosis, so you kind of have to, really be sure that you're actually treating the root cause of the problem and not something else, which is, which it could be. So the only way to do that is probably just to reassess and really test them functionally and try to recreate their pain in the clinic. I think that's the only way to really understand what it is that's causing their problem. So that's what I do. I'm really interested to see what the other physios or people who are into physio would do. I'd really like to just, start a discussion or something. You can basically just share your opinion by commenting down below, and I'll just jump in and start speaking to you. So if you made it through to the end of the video, well done. Just comment down below what you would do in this sort of scenario, given the circumstances. And don't forget to like and of course subscribe as well, and share this with any other physios that are watching. Thank you, and I'll catch you guys soon. Cheers.